Do you have piriformis syndrome? If so, what is it and what can you do to get over it? I'm Dr. David Geyer, orthopedic surgeon and sports medicine expert. I share sports, exercise, and injury information, as well as stories from some of the world's best athletes and coaches to help you become a champion in sports, business, and life. Piriformis syndrome is fairly rare. I mean, you see it sometimes, especially in runners, but it's not something that affects a huge percentage of the population. But if you have it, it can really be something that limits what you want to do and can be tricky to overcome it. What this is a cause of buttock pain typically in active people. Again, it's almost always runners. Sometimes though you might see it in avid cyclists. The piriformis is a muscle of your buttock, and right under that, the sciatic nerve that runs all the way down your leg to control the motion of your lower leg, your ankle, and your foot. It runs right under the piriformis muscle. And for some reason, usually overuse, but sometimes it can be a traumatic event, that piriformis can either get inflamed or swollen or sort of stiff and tight, and then that puts pressure on the sciatic nerve. Now, unlike the sciatic, people that complain of sciatica, that complain of pain that radiates all the way down their leg into their foot and into their toes and have numbness and tingling, this is typically more buttock pain specifically, and it's usually when you're doing the physical activities rather than bothering you 24 hours a day, even at rest. But it sometimes is more than just buttock pain. It may radiate a little bit down the back of your thigh, but typically you don't see the numbness and the tingling, and again, typically the pain doesn't shoot all the way down your leg. Now, fortunately, the surgery is almost always non-surgical. You can usually get over it without having surgery. So it may be short-term use of something like anti-inflammatory medications. It may be giving up the running for a short period of time and switching to some exercise that doesn't bother you, activity modification. Could be a lot of work with a physical therapist, and they'll work on things with you like stretching out the piriformis muscles and stretching and strengthening the other supporting muscles around the hip and around the pelvis. It may be things like dry needling. Occasionally, referral to a spine physician or spine surgeon, they may talk about nerve root injections or things like that if there's a question of, well, is there a bulging or herniated disc associated with it? It really sort of depends on how you present and what the potential symptoms are and what specifically could be leading to this problem. But again, usually it does not need surgery. But it's also not one of those things that typically goes away in a day or two of treatment. It may take a little bit of work to get back there. But at least in my experience, and I think most orthopedic surgeons that deal with a lot of active people, almost always people get better and they get back to what they love to do. Now, if you want more information and more videos on injuries like these to help you become a champion in what you love to do, click the video below, and I look forward to seeing you real soon.